Jerry, and Cathy and Jerry are both patients, but today we're here to talk to Cathy about why she is here. Cathy, can you tell us what brings you to Active Health Knee and Shoulder today?
Well, actually, first my husband was the one who brought me here, but the reason why is because I have rheumatoid arthritis, polymyalgia, and my knees. My knees are bad.
All right, and how long have you had problems with your knees, Cathy?
My knees, maybe 2 years.
All right, and can you tell me a little bit about how your knee problem is impacting your life negatively?
It's pretty bad. It's hard to walk. It's hard to walk. So you can't run. I can't get down on the ground to play with my grandchild, or even do yoga, on a mat. So it's impacted quite a bit. It's just hard to do everyday life things.
Yeah, well, I'm so sorry that you experienced that, but I'm so excited that you chose Active Health Knee and Shoulder because I really do think you're going to be happy with the results. We're going to go through some exercises now, Cathy.
Okay.
So I'm going to have you stand up. Okay, so when you just went from a sitting to a standing position, can you tell me how that felt?
Okay, I think we have to clarify. This is the afternoon.
Uh-huh.
And I am better in the afternoon, have more energy in the afternoon. In the morning, I have no energy.
Okay.
So there's a big difference. In the morning, it takes longer to get up.
Okay.
And it hurts to get up.
Okay.
Right now, it's weird. And I'm on medication from arthritis, and I think that helps me.
Okay. All right. So when you stood up, did you feel any pain in your knee?
I really didn't.
Okay. All right. All right. I'm going to ask you to step forward. Okay. And we're going to put your arms straight out in front of you, and I'm going to have you squat down. But I only want you to go as low as you feel comfortable going, okay? And when it starts to hurt, stop. Okay? Good. Can you get back up?
Yes.
Good. All right. Good job. How did that feel? Did you feel any
hurt in the knee?
in the knee? Can you show me what spot? In the front, the back, or the side?
It's about right here.
Okay, perfect. And I'm going to have you come down the stairs.
Okay.
Just at your own pace, how you normally would do it. All right. How did that feel?
Okay. My knee was fine.
Okay.
It was my arm and my foot.
Okay. All right.
My feet are swollen. My ankles are swollen and stuff.
Okay. So there was no pain in your knee coming up there.
No, there wasn't.
Okay.
Because the pain of the other stuff.
Yeah. All right. So now we're just going to turn around, and you're going to hang on while you go up the stairs at your pace, as you're comfortable.
It's more my foot that's going to be problems.
More your foot. Okay. So you didn't have any pain there in the knee?
No.
Okay. All right. Perfect. We're going to go on inside and get with the doctor and have your non-surgical procedure now.
Okay.
Nice deep breath. Pull your knee up. Good. Take a nice deep breath. Pull your knee up. 2, 3, 4.
And tell me how you feel.
It does feel better.
It feels
I
better?
have to say, definitely better.
Okay, great.
There's
Is it?
definitely a definite
shoulders?
difference. Much better. They were
You don't even know. You were paying attention to your knee, but we
Right, they were burning at first, but now yeah.
Good.
Yeah, definitely.
We're back with Cathy. She's had the procedure done on her knee. And Cathy, just give me a little bit of a summary of how that was and how you felt and how you feel now.
Right, it was interesting what he did and everything, but I feel so much better. I really do. He even worked on my shoulders, and I have polymyalgia, so it really feels better. Much
Great.
better. I feel much more open. I feel like I can breathe easier. And
Yeah.
You do feel different. You do feel different. You feel like you had a massage. That's what it was. You feel like you came from a massage, even though you didn't go through a massage. And it just feels like you feel more relaxed, more.
Nice. Well, congratulations. Now we're going to go through the exercises again to compare. So I want you just to stand up. You didn't have any pain on the first time, so I hope you don't have any pain now.
No, I don't.
Okay, great. And now we're going to just take you don't even have to step forward because your husband's not there to catch you.
Okay.
So just put your arms out and now squat down until you're uncomfortable. Okay.
It's about the same.
Yep, it is, but it was a much more fluid
Right.
motion. Yep, you can go
Okay.
back up.
Okay.
And that motion right there was
Right.
even better. All right, and now we're just going to come and walk the
Okay.
stairs again. And I know that your knee didn't hurt a lot, but I'm
Right.
hoping.
But if you notice, I have to do one step at a time.
Yep, yep,
I'll do it, but usually I do one step at a time.
yep. And we're going to retrain that knee to not do that.
Okay. Okay. And then going up, it's easier.
All right, great job, Cathy. Would you consider this a positive result?
Oh, definitely a positive result.
All right, and then can you just give me maybe a brief answer on how did you feel working outside your insurance? I know that it's different. Most people really depend on going through their insurance, and we don't do that here because
Right.
it's not covered.
I know it's I'm glad that I have the money to do it, but it's just frustrating that they don't consider this, because it definitely, you get more results than if you go to a doctor and you get medication, which just makes it worse because it's going to do something else. And you do get better results not having to go through like knee surgery. It just we felt it's worth it. It's worth it. We just wish that they would recognize it. Because
Absolutely.
honestly, this would be cheaper than if you go the medical route.
Absolutely. Average knee surgery, $80,000.